Good afternoon. Thank you for choosing to spend a part of this beautiful fall day with us here at Welcoming Wellness, where we are empowering mental health caregivers. I want to let you know that the purpose of this initiative, and it's to educate and provide resources to caregivers, friends, family, and allies of people who are suffering from mental health issues. We also aim to create a community of care where everybody feels free to come and ask for help when they need it. So I wanted you to know also that Welcoming Wellness is an initiative of White Plains United Methodist Church in Cary, North Carolina, and it's for the community. Everyone is welcome. So let's talk a little bit about what we're going to be hearing today. We're going to hear from Amanda Clerkin and Melissa Chacona. I want to make sure I said that name right. Amanda is a licensed clinical social worker who works in many different areas, but is especially interested in addiction and recovery. We also welcome Melissa to give us a firsthand account of the cost of addiction, as well as sharing with us the hope of and the hard work of recovery. So if you would put your hands together and let's welcome Melissa and Amanda.
Hi, my name is Amanda Clerkin, and as Robin mentioned, I'm an LCSW. I've worked in the field of mental health and substance use for over 20 years. I had to start saying over 20 years a while ago. I was like, wow, I can't believe it's So, but I started off my career working with kids who had been impacted by substance use disorder. And that's really, I started my passion was working with kids, and I worked on doing some family therapy and developing a parenting class for people in recovery. And I found it extremely rewarding. I started working with adults as well in a community mental health setting. So I've also done inpatient and outpatient treatment with folks who have substance use disorder. And I just want to say, I'm so excited to be here and talk about this. This is something I've been working on in various capacities for many years. I currently have a private practice, and I also work as the coordinator or director for a program for folks getting out of federal prison who are getting their lives back together. And we provide addiction and mental health counseling for that as well. So I'm very rooted in helping people who really feel kind of at that point of just hopelessness and what can I do, and really just struggling to take that first step. And it's really just an honor to go through that with them and see the changes that they make. You can see really big changes really quickly. And I'm excited to have Melissa here. I'm going to go over some facts with you, some information, and then I think her story will help put some of that in context. So I'll talk about several different things, and I think it'd be exciting to have her tell her story once I go through those slides. So the first slide is really about why. Why does it matter? Why do we talk about addiction? Well, first and foremost, we know that 23% of people avoid asking for help because of the stigma of addiction. And we know that, more than 20 million people ages 12 and over are battling some kind of substance addiction. And so what may have started as a choice for them has kind of becomes a habit and then a compulsion. And so from the outside, it can be really hard to understand why someone keeps doing the thing that's causing them harm. And that's where sometimes a lot of judgment can come in, and people can feel ashamed or embarrassed or judged and feeling like if I talk to somebody about this, I have to share all these things that I feel really badly about. And so oftentimes people that need help go without it. And so I want to really make clear how important it is to break through stigma. And that's why I'm glad you guys are here today. And people are here as well on Zoom, because the more we know about addiction, the more we can help each other. So also promoting empathy and encouraging recovery. So addiction does not discriminate, right? It doesn't matter what your socioeconomic status is. It doesn't matter what your age or your race. Anybody can develop an addiction at any time. And so it's important that we remember that because I imagine everyone here either has struggled with an addiction or knows someone who has struggled with an addiction. And putting yourself in their shoes is really important and encourages more people to seek out help. So when we tell our stories, when we talk about recovery, it helps other people see, well, maybe if they got better, I could do that, right? And so that's super duper important. And I think for prevention, one thing I want to note that ties into that is that adolescents have increasingly or decreased their use of alcohol and drugs. So statistics are showing that less young people under 18 are engaging in drugs and alcohol. Not only just using, but like misusing as well. So why is that? Well, part of it is the stigma is reduced, right? If you go on TikTok, there's like 1 million TikTokers talking about addiction all the time. You can watch TV shows about it. And kids today are feeling less shame about it and don't see it as something that needs to be secretive. And if you look back at the 1930s when AA was invented, it was anonymous for a reason, Alcoholics Anonymous. And it served a purpose. But several years ago, many people in recovery started saying, I want to tell people about my story. I'm not ashamed. I'm not embarrassed. And I want to help other people by telling my story. So we've seen a real shift. And that's where the prevention comes in. The more people that tell their stories, the more people that talk about this, the less likelihood we're going to see future generations having as many problems. It's not a guarantee, right? Also contributing to that, in case anyone's wondering, COVID-19 and people not getting out behind their screens, right? Adolescents tend to engage virtually more. So there are other factors, but you cannot ignore that stigma factor. So it's a huge deal, and I want to make sure we're aware of stigma as we talk today. Okay, cost of addiction. So some quick facts and sort of data about the costs of addiction. Couple facts that aren't on that slide. In 2024, more than 80,000 Americans died of a drug overdose. That's about 200 people a day. And so the costs of the mental, the physical, the spiritual costs to that individual and their families, it's really can't be quantified, right? So if we take 200 people a day and then we think about all the people in their lives, all the areas that they were connected, it has a huge impact, right? And still for adults ages 25 to 44, drug overdose is the #1 killer. So the leading cause of death is drug overdose. So while we have seen a decrease in use among young people, drug overdose remains a major cause of death. Something else interesting is that 25% of people who are prescribed opiates legally or opioids legally do develop a problem. So 75% don't develop any issues, but 25% develop some kind of, either they misuse the drug, they take more than they're supposed to, or they become addicted. So that's a pretty big number, right? That's an important one to keep an eye on. So addiction costs in 2020 was $1.3 trillion. It's estimated that 800 billion of that went to healthcare costs, 219 billion in lost productivity, and 100 billion in what we'll call criminal costs, which I'll delve into here with this federal budget if you want to know where your tax dollars are going, right? So the U.S. federal budget in 2024, about half of it went to treatment. So what they had allocated for fighting addiction, about half of it goes to treatment. And if you look at kind of the other half of that, about 42% goes to preventing trafficking. So trying to keep drugs out of the country, and also law enforcement, which is, the illegal intervention of people who are using drugs. So that's a big chunk, and only about 6.5% goes to prevention. So I don't know about you, but if I have a problem, I like to get ahead of it, right? Rather than trying to respond, right? And so what we find in a lot of bigger systems is a reaction. And so reacting to the problem let's throw money at reacting. But if we kind of flipped that, imagine the changes that we can make. So, okay. So what is addiction exactly? It's a big word. It's a lot of, I'm sure all of you have in your own mind, your own definition. But just like heart disease or cancer, it's a treatable illness, and it requires a combination of treatment, supports like from your family and your community, and lifestyle changes. So it's a chronic relapsing illness where the person just continues to use despite negative consequences. We're all wired for pleasure. Everyone here has something they like to do, right? That's just human beings by nature. We like to seek out things that feel good. So like shopping or food or hitting that slot machine and winning the jackpot. Raise your hand if you ever wanted to do that. Okay. Something that makes you feel good, right? And so what happens when the reward center of your brain is activated, you get that dopamine boost. And what starts off as normal use can slip into habit, right? And your habit and your reward centers in your brain literally sit on top of each other like this. It's really easy to develop what we'll call a bad habit, just as easy it is to develop a good habit. But it's really easy when that you get that feel-good chemical and it over-circuits your brain. It's really easy to become addicted. And activating the reward circuit in your brain also impacts our memory and our decision-making skills. And we become overwhelmed by the desire to use. So, for example, there was a study in the VA did a study of veterans who had become addicted to methamphetamine. And those who were more likely to relapse had lower functioning in their prefrontal cortex, the part of their brain where rational thought overrides impulse control. And the doctors who did that study said that they could just look at someone's brain and figure out whether they were going to relapse. So, we cannot underscore the importance of the prefrontal cortex and the brain when it comes to whether or not you'll develop a substance use disorder. So just like, I want to give you kind of a context here, just like high blood pressure or asthma, addiction, relapse comes with the territory. And so I want to use hypertension as an example. If you have high blood pressure, hypertension, and you go to the doctor, chances are you're going to get medication and you're going to just participate in some lifestyle changes. Maybe you'll join like a walking club or start cooking more at home, eat less salt. And you're going to try to do those things so you have a program because you want to stay healthy, right? You want to reduce your blood pressure, so you know the dangers. So you go do that, but then suddenly there's a death in your family, right? Someone immediate, close to you. And maybe you stop doing those things that are working for you. You've lowered your blood pressure, you're in a good place, and all of a sudden now you're not cooking at home as much. Maybe you're eating takeout, or you're not doing your walking club, you're not going to the doctor. And so you have kind of two roads at that point. So you could continue on the road you're on, or you could say, hey, I need to get back on track. So addiction is similar. Same kind of thing. You've got your tools, you've got your community supports, connections, therapy, medication. And just like anybody with a physical illness, if something bad happens, you can relapse. You can fall back on old behaviors. In that example, maybe someone with an addiction their program's going really well and they haven't used any substances in a long time. They're attending 12-step meetings, they're going to therapy, all the things. And then suddenly, again, a death in the family. Maybe they decide, I've had a really bad day. I'm going to have a glass of wine. I deserve it, right? And that's where the justifications start. And then next thing you know, the bottle, right? Next thing you know, that person isn't feeling well. They're not contacting their people. They're isolating. And so just like that person with high blood pressure or hypertension, that's where the relapse can cause you to have serious health consequences. And I don't know about you guys, but when you're not feeling well, whether it's physical or mental, and you isolate in your bed right? Lay in your bed and just stare at the four walls. You don't feel very good. And so getting out there and doing something is so important. And so that's why these structural programs are so important. And that's why when we think about addiction and we compare it to something physical, there are so many similarities. So, and then in terms of mental health, really, it's like a chicken and the egg, like what causes what, right? Well, guess what? Both can impact each other. Both substance use and mental health can impact each other. And so when we look at people with mental health issues, about 50% have at some point in their life dealt with a substance misuse of some kind. Not maybe full-on substance dependence, but they've definitely, about half have dealt with some kind of issue with substances. So we know, for example, people with substance use disorder, there's a high co-occurrence with things like bipolar disorder. So when people are manic, they seek out, they want to get that dopamine fix, so they're more likely to participate in risky activities. People with ADHD have a much higher likelihood of becoming addicted. So there is definitely a correlation. So both substance disorder and mental health can impact the pathways in your brain. So the more you use those substances, the more your brain is affected, more likely you can be to develop an addiction. So we know alcohol is a depressant. And so that's why we see so many people struggling if they're drinking too much. Guess what? They're also feeling depressed. So they definitely there's a causal relationship. There's a connection there. And so the answer about like what causes what, well, they both interact with each other. They both affect each other. So I want to just do a quick example of back in the 70s when VA, when vets were, fighting the Vietnam War, and they developed PTSD. When they came home, high number of them had been using drugs and alcohol to cope. And so it's just an example of where somebody's developed a pretty severe mental illness, that's where substances can come in and be something that is short-term beneficial, long-term not so much. So, okay. So when we talk about addiction, I think most people go straight to substances, right? We think of alcohol, we think of other drugs. By the way, alcohol is a drug. I always try to make that clear. Sometimes I think when people sort of want to justify drinking, it's like, okay, it is a drug and it has an impact on your body. So alcohol and other drugs, nicotine, vaping, prescription drugs, and illegal drugs kind of fall under that. I did not include caffeine, which 80 to 90% of the population uses, me today. And also, many develop a mild physical dependence, right? And if you try to go off of it, guess what? You're going to have withdrawals. I don't know if anyone's ever had a caffeine headache, but they're terrible. So that belongs out there. It's, so it's not necessarily life-threatening for everyone, but it's definitely uncomfortable if you try to stop. So those are kind of your substance disorders. When we look at the treatment world, these are the ones, I know that these are the ones that are in our DSM, our Diagnostic and Statistical Manual. These are the disorders that are easiest to treat because we have a lot of history with coming up with cognitive behavioral therapies that work. Also, insurances will pay. So it's less of a barrier to get help for those. Now, just to be clear, not nearly enough people are getting the help that they need, but it is easier because those have they have a lot of research behind them. When we look at behavioral addictions, just to kind of separate those out, there's a lot of crossover, right? Many people that develop a substance addiction can also develop a behavioral addiction. In fact, gambling is one that we see a lot of. So people may stop using the substance that they were using, but they get really into gambling. And I think it's important because I know last month you guys did a program about suicide. I think it's really important to sort of point out that, gambling disorder is actually in the Diagnostic and Statistical Manual, and 50% of people in treatment have thought about suicide for gambling. And then 17% have actually attempted. So it's a pretty lethal, it's a pretty lethal disorder, and it's something to be taken seriously. And I think it's one of those that there are a lot of treatment options out there, but we kind of don't think about these behavioral addictions because, we think about it as it can really mess up your life. You can lose a lot of money, or your family. There's a therapist who he's nationally known as a treatment provider, and he actually got really into day trading. He was a marriage and family therapist, and then he was like, I'm going to try day trading. And he was doing really well. Everything was great. And he was like, I'm making a lot of money, until he wasn't making a lot of money anymore. And then next thing you know, denial works really well, right? And he's like, oh, if I just keep doing this, eventually I'm going to get my money back. Well, the short end of that is he lost contact with his kids for 10 years, went through a divorce, and he lost everything. He now works as a therapist helping people that have gambling issues. But it's kind of a reminder of we think about substance disorder, we think about the physical aspect of it. What can it do to your body? But with gambling and other behavioral type disorders, we can see the environmental impact or how it can affect your life. What they all have in common, though, is that people continue to do the behavior despite the negative consequences. So on that list for behavioral, we have work. I put work and relationships there. These are not diagnosable disorders. There needs to be a lot more research on that. But people can engage in behaviors that are unhealthy for them and can have negative consequences. Sex, pornography, as well. Though that is a group that we diagnose usually with a compulsive sexual disorder. Some of those people have a history of trauma, childhood trauma. Not everybody, but some do. That's sort of significant there. Food is often diagnosed as binge eating disorder. It's more often diagnosed with women, however, I think probably just underdiagnosed with men. And so it's something that we see a lot of women participate in treatment, and there's also a 12-step program for people with a food addiction. There are 12-step programs also for gambling as well, and we probably need one for social media. That was my next one. So we know that 90% of kids have access to the internet or some type of electronic device, social media. And we also know that 65% of adults participate in some kind of game online, whether it's a video game or just any kind of gaming. And so the field is still doing a lot of research. We definitely need to be doing more research there. And I think that's kind of the next step in terms of the addiction field and behavior addictions. That's where we need to be going. It's definitely, I wanted to bring up e-cigarettes as well. They're about 5 to 10% of the population of children are using e-cigarettes or vaping. I think it's probably higher. This is a statistic that I got online from our federal government. So I think probably it's just underreported because it seems pretty prevalent. I know in some schools here, they've had to close the bathrooms off because so many kids or lock the bathrooms because so many kids are vaping in the bathroom. But we know it's a big problem. And there are parents who have gotten treatment for their kids. But it is hard, again, with insurance. Insurance doesn't necessarily cover vaping, right? And overall, about 50 million people still smoke cigarettes. So we still have about 50 million people in this country that are smoking, even given what we know. So, but yeah, so if we think about, it's a little bit complicated. We think about behavioral addictions, are things that, people will do. They don't necessarily always cause, they don't necessarily cause life or death, but substance use, when we talk about that. So those, if you hear me mention those, that's what we're delineating, we're separating here. Okay. Okay, so the continuum of use, I like to talk about addiction in phases, and they're just sort of a different kind of steps from one end to the other. So abstinence is what I was talking about with those kids that are just like, I'm not going to drink or use drugs, right? And that's abstinence, no risk. So that's at the first end. That's our one end here. That is what some people in recovery choose for themselves. They say, I'm going to go for abstinence. I don't have the ability to moderate my use, and I definitely need to be abstinent. Interestingly, not everyone that considers themselves in recovery goes for abstinence, but that's another topic for another day. Recovery has a lot of definitions for people. So, but for some people, abstinence is the only option. The next level is what we'll call low risk. Very few consequences. This might be the first time someone decides to use something. This might be the first time that someone experiments. It also could be under someone who takes prescriptions as prescribed, right? It has a lot of definitions here. So it may be somebody that like, oh, I have a glass of champagne at New Year's. So the risks here are pretty low. It's not, or maybe someone that goes to Vegas and gambles once a year. So these folks, it's not right here in front of them. They're not thinking about it a lot. It doesn't have a big impact on their lives, but it might be a part of their life. And the important thing to remember here is that they're just not having a lot of negative consequences, right? They're not trying to cut their use down. It's not part of their world. They have a lot of other things going on. So kind of social users, people, again, who don't misuse prescription drugs. And I know how people that are in recovery are like, wow, I really wish that would have been me, right? I wish I'd been able to just go from so and when you do have an addiction, and we'll talk about the causes here in a minute, but yeah, I mean, that's ideally where most of us would want to be, one of those two. So high risk use is the next one. So that's kind of the next level. And this is really where we see this kind of the crossroads. So sometimes I'll see college students come in, they've had a DUI, and they're like, man, I never want this to happen again, right? It's almost like the two roads. So they're like scared enough that they had something happen to them, and they realized something got out of control, and their drinking got out of control, and they've got to get it to a point where it's manageable for them. So this is where we see more consequences, and people can either continue down the road to progress, or they might be able to walk it back. And this is where we this is where the decision is made if someone's going to develop kind of a full-on addiction, substance use disorder, behavioral use disorder, or they're going to be able to go back to moderate or normal use. So some examples of what we see. This is exactly where we might see someone missing work, or we might see somebody like isolating from their old friends and hanging out with people that are doing what they want to do, doing drugs or drinking alcohol. They might be changing their friend group a little bit. You might see some physical side effects, like they aren't necessarily going to be having withdrawals. They might definitely have cravings or desire to do the things that are giving them that dopamine hit. So again, we look at that as continuing to use despite negative consequences. That's kind of under that. It used to be called abuse, but we try not to use that language anymore because it's negative. It's stigmatizing to say abuse. So we try to just say misuse. So it's where people are misusing the drug. Okay, so then we look into substance use disorder. This is the big shift. And I think it's important to point out that most people fall in the first three categories. So about 70% fall in those first three categories. And that next section is where we fall into dependence. This is defined by increased tolerance and withdrawals. So where maybe you can have 2 drinks before to get a buzz, and now you got to have 4. And maybe you're blacking out. Maybe you are having with some mild withdrawals. So withdrawals can be both physical and also psychological, depending on the substance. And it's important to point out here that somebody may look like they got it all together, things are great, and they might be able to hide their addiction pretty well. Denial is one of the main kind of cores of addiction. Sort of a hallmark is that your judgment is clouded. And I can tell you that I have sat in front of people who are nodding off or not making any sense, and they truly believe that they're keeping whatever that they're high right in front of my face, and they truly believe it. And that's part of continuing to use, is you get that tunnel vision. And if you've ever worked with somebody that's, in chaotic drug use, that is part of it. So just because somebody maybe appears to have it all together, and even if you have some questions, it doesn't mean that they're doing okay. And they hide it really well. So that's part of it. It's just hiding that addiction. And again, it's about their judgment being clouded. It's about if we have to talk about it, I have to do something about it, right? And it's that fear of ooh, who do I talk to again? Going back to the stigma and the judgment, or maybe not being ready to quit. So oftentimes when we get to this point, the desire to stop is forced on the person versus them making that decision for themselves. And so that might be a legal consequence. People lose their children, or have a threat of losing their children. Maybe it's a physical, something, an illness with maybe their liver's going bad, they're in the hospital, and everyone around them is saying, you have to do something. And it usually is at that point where the person can make that decision for themselves, if they want to make that change. And I do think it's important to point out that it's, when you're looking at that on the outside, you can feel kind of crazy. What? How is this person not seeing this? But you have to remember that, their world is clouded by judgment, by their own internal judgment, and it's clouded by denial. So they're telling themselves they're fine. And their focus really is on getting that next, whatever it is, that substance. So, it can make you feel a little bit crazy if you know someone in your life like that, and you're like, gosh, trying to talk sense into somebody who's at that point is very difficult. And just encourage patience and love, and firm boundaries and continued support if you do encounter someone like that in your life. So, okay. So what causes addiction? Basically, what we know is that 40 to 60% of what causes addiction is genetic. And the other part of it is environmental. So for years, we've definitely had kind of an ongoing debate about what causes what. Okay, thank you. Okay, good. So what causes, we know that genetics are a big part of that. And we know that environmentally and socially, what happens to you as a child can also impact your ability to develop an addiction. And I think it'd be good for Melissa to share what she's going to share in terms of her experience, because I want you guys to get that context of what that looks like. So how your past can impact your present. And really quickly, just to say that adolescents, because they're wired for pleasure, and they don't understand consequences. As we all know. And so because they're wired for that, their decision-making is their frontal lobes are not fully formed. So if they wait until they're over 18 to use any substances, they're less likely to develop an addiction. And so that's where, when you're in your early 20s and your frontal lobe is developed, that's where the genetics have more of an impact. So early on, that environmental part is really important. And I'm gonna, because we had an issue with the video, I'm gonna have Melissa come up here and we're gonna skip those two, the ACEs slide, and then I'll talk a little bit about ACEs after she speaks.
Hello, and thank you, Amanda. Thank you, Robin, for hosting. I'm grateful to be here today and be able to share my story with you. My name is Melissa Chacona. I'm a mother to 3 daughters and a soon-to-be stepson. I'm a sister, I'm a friend, and I'm soon-to-be wife of the love of my life. And I've always had a passion for helping others. I guess it's in my blood. My mom was a nurse, my dad a pastor. So I knew that growing up, becoming a nurse was something that I always wanted to do. I also love gardening. I love watercoloring. I love cooking. So anything outdoors I love to do. And that all sounds pretty normal to everybody, right? Sounds like a normal person. But we know why we're all here today. The topic is addiction. So I am truly, indeed, an addict. So I was asked by my counselor, Amanda, to come today and share my story with you all. I am a member of NA, Narcotics Anonymous. And when we share a story in Narcotics Anonymous, usually there's like a format. So you talk about what you were like growing up, what it was like growing up, and then what it was like during your addiction, and what it's like now in recovery. So bear with me. I do not like speaking in front of people. That's something I've really tried to challenge myself. So I may have to stop and pause a little bit, but I'm going to keep going. I've also learned in recovery that getting uncomfortable is important. So you cannot change without going through those uncomfortable times. And I know that speaking is something I really want to do. I want to be able to reach other people. So I'm going to have to push through this uncomfortableness, and that's okay, because I will be fine. So you've heard Amanda speak about all of the educational aspects of addiction. And I wanted to share my personal experience. Just like any disease, like Amanda had said, heart disease, diabetes, cancer, there's always a prescription. There's always a treatment that is recommended. But just like for all those diseases, we are all individuals, and what works for you may not work for someone else. So that is the same with addiction. So whatever treatment has worked for Jane may not work for me. So I'm going to share what has worked for me and what has not worked for me. So it's really important to remember that. So anyway, what I was like, I grew up in a very loving Christian-based household. We were very family-oriented. I was the youngest of 4. All of us children were healthy, involved in life and sports, activities. We had a pretty normal childhood. So there wasn't any alcohol or drugs in my home. Maybe some wine with Easter dinner or Christmas, but addiction was not something that I was familiar with or exposed to. I did know that from a very young age, I always felt different. I always felt left out. I felt unloved. I don't know if I was the 4th child. My parents were busy. There was 3 other kids and they both had careers. So, but I do remember always having that feeling of being different. So as I went into adolescence, I started looking to fit in. So I started with those risky behaviors, looking into the older crowd. I idolized my older siblings, so I wanted to do what they were doing, which also included risky behaviors. So I did I did fall in love very young. I ended up getting pregnant. And this is the first time I really remember that I had a real issue with denial because I didn't tell anybody about it. I didn't tell my parents until I was well into my 6th month of pregnancy. I was 14 years old. And my parents did what they knew to do. You know, they wanted me to have a life. They, you know, and they are, you know, they did what they thought was best. They sent me away. I went to a home for teenage unwed pregnant girls, and they found a couple to adopt my baby. And that was a really hard time for me because that was also looking back. I remember I didn't have a voice. I was afraid, you know, I didn't want to upset my parents. I didn't want them, I just wanted to do whatever they thought was best. And so my dad, being a pastor, had a colleague, an old friend, that had a daughter that couldn't conceive. So it seemed ideal that she would adopt my baby. And so that happened. And the adoption, it wasn't really talked about after that. So after I had her and gave her up, I came home once I looked like a normal teenager again, and you know, it just wasn't talked about. And I don't know if it was because it was so uncomfortable for my family to talk to me, or if it was because I was so quiet about it, they just didn't think I wanted to talk about it. But anyway, I didn't get treatment. I didn't, you know, I kept a lot just closed up in this vault of shame. And shame is something that has carried through my life. And I'll go into that a little bit deeper. But I'm just going to reference my notes here. Give me a second. All right. So on to going back into high school. Drinking and smoking pot became a normal weekend thing. Again, it was just trying to fit in, trying to be normal. I was always wanting to be normal, and I thought that's what everyone was doing, so that's what I did. Graduated high school, went to college, moved to North Carolina, finished up nursing school, got married. You know, everything seemed pretty normal. When I was in college, I did start engaging in more risky behaviors as far as harder drugs. It wasn't just the marijuana anymore. It was maybe cocaine, ecstasy, you know, but it was never a problem. It was always something that I did. It was fun. Put it down, go on with life. It wasn't until after I had my first daughter, actually she's my second daughter, Abby, and I was prescribed Percocet, which I'm sure most of you know, it is a strong opioid given for pain. I was prescribed that after my C-section, and that was the first time that I made that connection with a drug, that I remembered thinking, this is how I want to feel. You know, I could smile, it gave me energy, and I mean, I knew about the drug. I was a nurse, and I, you know, gave this to my patients, but I fell in love with the way that it made me feel. And again, after my prescription ran out, I put it down, moved on with life. I was not addicted, but I did have that, you know, that part of my brain was activated. I definitely can see that now. And then a couple years later, I had another child, Isabel. And at that time, my oldest daughter, to kind of make it, my dad, the colleague, the old friend, the old pastor friend of his wife had passed. So my dad went to the funeral, and my oldest daughter was there. And I remember my dad calling me and telling me, I met your daughter, you know, and so it was like, I'm sure you've all had those pivotal times in your life where something has just hit you and you knew that like nothing was going to be the same after that, you know? I've had several of those, and I remember feeling really angry at my father, resentful that he got to meet my daughter that he gave to someone else to raise, you know, and like I had never felt that much anger before. And at that same time, having Isabel given the Percocet, you know, like I just latched onto it, you know, before I didn't have a reason, but in my head now I had a reason, you know, and I was gonna keep that to myself, and I did. And so that's when I started, you know, looking for more refills of my medication. And when those ran out, I went to work, you know, I went to work where I dispensed narcotics, specifically opioids. And within a second, all of my morals were gone. Everything I was raised with, the oath I took as a nurse, all of it just out the door within a second. And then all of a sudden you're on this vicious cycle, this roller coaster that, you know, you're looking for that euphoria. And then once that brief moment of euphoria is over, you're looking to numb the feelings of shame and guilt. And it just becomes this vicious cycle. And then those moments where you're feeling the withdrawals because you can't get your medication, and then all of a sudden you're stuck, you know. And I know that this holds true for a lot of addicts. Like you get to a point where you just get tired of living, you know, like it's just, this is no way to live, you know, like your brief moments of euphoria become less and less and less. And suicide was something I had thought of, I contemplated a lot, because nobody knew. No one in my family knew. Not my parents, not my sisters that I was close with, my children, my husband at the time. And I didn't know how to tell them, you know. It was so far from what our reality was, that, you know, how was I going to explain this? So, I got caught and I was arrested at work, and I've been in outpatient treatment. I entered the nursing alternative program. I was able to keep my license, which I was very grateful for, because I was very passionate about nursing. I love my job. But anyway, I did keep my license, and went through the program, which took about 5 years. And it was in a 12-step program. I had a sponsor. Life seemed to be going pretty good for a while. I ended up divorcing my husband. We grew apart. I ended up buying my own home. There were so many good things that were going on. And again, what a lot of addicts can tell you is that there was just always something missing. And at that point, I was missing a companion. I was missing someone to share life with. And so I just started doing these, you know, the online dating, the risky dating, and just not putting much thought into what I wanted or what I needed. I never put myself first. Anyway, got into a bad relationship, and started relapsing in my head, you know, just trying to think of ways to escape again, think of ways to make everything feel better, and just escape, you know. So I had always told myself, if this were to ever happen again, I would give up my nursing license. You know, it's like an alcoholic doesn't need to be bartending. You know, I don't need to be around it. So I had always told myself that. And, you know, it took one bad day, one bad decision, and one moment of not being connected with my recovery. So what happened when I started dating, I wanted to start hiding all of my bad baggage, you know, like the being an addict, having a child at 14. I carried so much shame for that. You know, nobody knew about that. And so the further I traveled from my recovery, the closer I got to relapsing. And eventually it happened. And when it did, it was bad. It was real bad. You know, my addiction shouted out in glory, and I cleared out the entire narcotic cabinet that my manager had so dearly entrusted me with. I was the nurse manager. She had given me the keys, and yep, I did it good that time, and was caught again. Went to rehab for 28 days. This time was inpatient. You know, so the progression stepped up a little bit more. Came home, and thankfully, by the grace of God, He has given me a family that has stuck by me and supported me. I was able to keep my house. They helped me with my daughters because, you know, by the time I relapsed that second time, they were old enough to know. So, and that was really hard. That was really hard for them to process. You know, they knew me as their mom, not as a drug addict. So, but I am grateful that they've all stood by me. So once I came home and started putting the shattered pieces back together again, I started working in furniture sales. And then it was about 9 months after I had gone to rehab that I was surrounded by SUVs, pulled over, shackled, ankles, wrists, the whole 9 yards, and taken down to the federal building, and was charged, indicted federally for several different charges. That was another moment that it just seemed out of body. Like, how is this happening? You know? But it did. It happened, and I was federally indicted. And I stood on pretrial. So that morning was January 4th, 2020. And I wasn't sentenced until May 22nd of 2023. So for about 3.5 years, I stayed on pretrial, which it was tough. It was really tough. It was hard to be stuck in limbo and not really knowing where my life was going. I had attorneys telling me I was going to be serving 10 years. And then there was still this part of my brain that was like, maybe I'll just get probation. You know, so there was anywhere from probation to going away for 10 years that was just rambling around in my head. And thankfully, I got 4 years, you know. It's funny, Jason and my fiance were having a conversation, and he asked if I felt like that was a fair sentence. And, you know, when I self-surrendered into federal prison that day, that's when I give myself my clean date, because that is when I truly surrendered myself to God and became honest with everyone and myself. And those were the hardest first few months. I can honestly say, you know, God was there and listened to me every single day, but my family that He put in my life stood by me and religiously visited me. And my sponsor came to West Virginia. You know, I had visitors every month, and made that time pass. And I think looking back, I'm grateful for that pretrial time, you know, even though I think that I could be all of this legal stuff could be in the rear view by now, you know? But everything happens for a reason, and I see that everything happens in God's time, because during that 3.5 years, I was able to be there for my mother as she was fighting for her life through cancer. I met Jason, my amazing fiance that has been my rock, and we're getting married next month. And without that time, that 3.5 years, I wouldn't have had any of those opportunities. So, and then the time that I stayed in Alderson, West Virginia, at the federal prison camp, I learned so much about myself. I mean, even though it was horrible to say, and I was almost ashamed to say it, but I'm glad I went, you know? I'm glad that I was able to go. I did their 9-month residential treatment program, which was a CBT program, which is cognitive behavioral therapy. I was able to take a look at a lot of my behaviors. I was able to dive into my shame and really figure out what that was all about, because shame and trauma, like, those things can be a twisted mess and cause us to do some really unthinkable things. You know, and I know for me, like, I've always wanted to know why. Why did I do that? You know, if I'm a good person, then why would I do that? And the CBT program helped me understand that I am a good person. And I truly feel that today. Like, I know my worth today, where before I didn't. I'm proud to say I'm an addict today, where before I wanted to hide from it. I didn't want people to know that I had that problem because of that stigma, because that's ugly, you know? Who wants to be addicted to something? I didn't want that. But today I'm grateful for that. Today I can find a place for it in my life, you know, and I'm no longer nursing. I will never nurse. I will never have RN behind my name ever again. But that's okay. I found peace with that. And today I look forward to becoming a peer specialist, a peer support specialist, and helping others. And there's so many ways that I can help others. I don't have to be in the hospital or a clinical area. But helping others is definitely ingrained in my soul, and I know that that's somewhere I need to go with. Specifically the medical community. And that was another thing that opened my eyes so much when I went to prison, that I wasn't alone. For so long, I had separated myself from other people. I wanted to compare myself to that addict that was homeless, that person that didn't have, you know, the best hygiene. But when I got to prison, we were all the same. We all wore the same outfit. We all did our laundry at the same place. We ate the same food. And then once I sat with that and actually allowed myself to make connections with other people, we are all the same. You know, it doesn't matter where we came from. It doesn't matter what I did with my life, or if I'm educated and you're not, or none of that matters. The disease is universal, and we are all children of God. And that was a huge turning point for me. It's just finding that connection with other addicts. And that's something that I want to continue in my life. I feel very strongly about having that moving forward. So I was released on February 26th. I'm going to wrap this up real quick. I was released on February 26th, 1 week before my mother passed. Jason worked tirelessly to get me out. So I was only actually in the prison camp for 21 months. But gratefully I was able to spend that last week with my mother. And I'm serving the rest of my sentence out on home confinement, which will be over on December 5th. So that's right around the corner, right after our wedding. So, if you've grabbed anything from today, just the addicts come in every size, shape, and form, and that we all need to treat each other kindly with empathy, because we don't know what someone else is going through. We don't know what their struggles are. I did not let anybody know what my struggles were, so we don't know, and we don't know when somebody is contemplating ending their life. And if I can give any ounce of hope to another suffering addict, I intend to do that.
Thank you so much for sharing that. I'm definitely was moved to, well, looking forward to you coming back up to answer some questions. So I was thinking about the importance of having somebody with lived experience speak today. She was the first person I thought of, and I saw, it was just so nice to see her family and support here. Because I can just tell you guys are like the biggest cheerleaders too. So it was very moving for me to see that. So I get to hear from her, but it's nice to see that. So, and just the importance of that connection. Let's, I really, because of, I want to be clear with time, I wanted to mention this. There are some sheets over here. Is anybody here familiar with adverse childhood experiences? Yeah, some people are. This is one of the largest studies done it's really across the world now. It's a 10-question study, and it basically found the connection between adverse childhood experiences and difficulties later in life, whether it be physical health, mental health, and looking at those categories of abuse, neglect, household dysfunction, and community violence or trauma. And I would suggest, if you have the time, to kind of look up the where it started. So, thank you. Look up where it started. And if you have a score higher than 4, you're 2 to 4 times more likely to develop an alcohol use disorder, and also 2 times more likely to develop an addiction to another drug. There's lots of data out there. It's great if you work with kids, or you have kids in your life, or you work with adults, or you want to just see where you fall on this. It's a good informational tool to help see how adverse life experiences can impact you in the future. I suggest everybody do it, and we have this assessment over there. So I think and then this guy, I think he's done a lot of research on addiction, and his famous quote is, "The opposite of addiction is connection."
Almost everything we think we know about addiction is wrong. You get a rat and you put it in a cage, and you give it 2 water bottles. One is just water, and the other is water laced with either heroin or cocaine. If you do that, the rat will almost always prefer the drugged water and almost always kill itself. Professor Alexander comes along and he looks at this experiment and he noticed something. We're putting the rat in an empty cage. So Professor Alexander built a cage that he called Rat Park. In Rat Park, they don't like the drugged water. You go from almost 100% overdose when they're isolated to 0% overdose when they have happy and connected lives. What if addiction is an adaptation to your environment? Human beings have a natural and innate need to bond. And when we're happy and healthy, we'll bond and connect with each other. But if you can't do that because you're traumatized or isolated or beaten down by life, you will bond with something that will give you some sense of relief. The opposite of addiction is not sobriety. The opposite of addiction is connection.
And this study, when you get a chance, if you look up, he has a really good TED Talk. This was just like a minute video about kind of a summary of the opposite of addiction is connection. I think that's just so important. If you walk away with anything today, it's just, and hearing the information that we shared and hearing Melissa's stories, like the importance of having that person in your life or that community that helps you realize you're not alone. These are just, how do you know if someone that you love is struggling? There's 3 kind of categories. It's change in behavior, emotional or physical changes, and then money or legal problems. So I'll start with, I'll just go ahead and, so change in behavior, it's losing interest in things that they used to care about, potentially isolating, not being as interested in things or people that they used to care about. They might be taking big risks. They might be also missing work or school, lying about little things or big things. One thing about people in addiction is you'll find as they head down that road to either substance use disorder or even relapse, they might lie about where they ate lunch, right? And you're like, wait, they didn't eat lunch there. It's good things to pay attention to. So it's the big stuff, but also the little things. And the denial piece is huge. So denying their use. Money or legal problems, this is pretty straightforward. They might want to borrow money from you. They might steal money. They may have legal issues. And then show an inability to manage money. Like, where did the money go? It's hard to explain. So, and then the emotional, physical changes. These are just some. There are obviously a lot. And not everyone is not the same, but this is just some general ones you might notice. Somebody has a lot of mood swings. You know, they become more angry or paranoid. Definitely defensiveness. Just kind of a lack of caring in general. You might notice their appearance looks different. Some ideas that they could be, or some signs they could be withdrawals, shakes or tremors, glassy eyes. They may be gaining a lot of weight or losing a lot of weight. They might not feel well, just generally sweating or upset stomach. And Melissa actually touched on this, so there's just treatment, there's just so many options. So it's defined, you define what recovery looks like for you. And the basic options. We look at medication assisted treatment. Inpatient treatment is generally about 90 days. Outpatient treatment varies. 12-step programs, individual therapy, community connections, a lot of pro-social activities. So she mentioned gardening, just things that she enjoys in her life, her kids, her family, her fiance. Like having a lot of pro-social activities is really important. Treatment is individualized, as she already said. Everybody's different. Everybody has different needs. So we really, when we look at treatment, we look at, we do an assessment with each person, and we don't do this cookie cutter approach. So we do an approach of like, what are people's strengths and weaknesses, and, what are they willing to do at this point? Because that's the most important thing, is what are their expectations? There is research that shows ongoing support is how people maintain their recovery. That's pretty basic. But the importance is like long term. We look at this as something that's chronic, continuing to be connected to something that is keeping you on the right path. So it could be group therapy is extremely powerful, and aftercare programs that are group connecting can be really helpful. Individual therapy, 12-step programs work for some people, they don't work for others. And I just want to say to anybody that has tried that and thought, oh, it wasn't my thing, there are a lot of groups out there. If the 12-step wasn't for you, there are other groups. So just remembering there are a lot of options. And then in terms of preventing relapse, just remembering that, like you're not alone, and all you have to do is kind of reach out to somebody, making sure you're not isolating. Then finally, I hate to do this one last because it's so important, but addiction is a family illness. Family members recover right alongside those who are in recovery, are working through. Family members, I put 3 to 5 years. It takes 3 to 5 years to fully recover. That's for if it takes somebody. So there's research about people that get addicted to methamphetamine, and it can take 3 to 5 years for recovery, depending on how long they were using. And family members tend to take that long. So just a reminder that your family members, if you are a family member, you're going through the same emotions that they're going through. And a big part of it is rebuilding that trust with that person. And you're going to have some of the same feelings. And the 3 C's are very helpful to those who have someone in their life who has addiction. Is you didn't cause it, you can't cure it, and you can't control it. Basically, like a lot of kids or partners will think, what did I do to make this happen? And you didn't do anything. You don't have anything to do with it. So you can't cure it, you can't fix it. And a lot of times people will try to control environments. Like, if I just do this for this person, it'll be okay. Just remembering you can't control this. Okay.
Ladies, thank you so much. I know this was again, another difficult subject, as most of mental health subjects are, and we so appreciate you coming and talking to us. As you know, our services are free, but if you would like to donate, there's a big Donate Now button on our website. The website is welcomingwellnessnc.com. And I want you to know that 100% of anything you donate does come directly to us for the furtherment of this mission. One more thing today, one more way you can help us is if you are on Facebook or Instagram. We're doing a marketing campaign right now. So if you'll go to Welcoming Wellness NC and follow us, invite your friends to follow us, and like and share the individual posts that we put up. That would be extremely helpful in helping us to get out to the community. Okay. Thank you so much for your time and attention today. And until we see you again on November 16th, please take good care of your mental health.